Introducing Silhouette Soft Thread Lift. Silhouette Soft patented thread lift technology delivers gravity-defying effects, repositioning sagging skin so you can say goodbye to the visible signs of aging. Following a consultation, your aesthetic expert will insert Silhouette Soft's reabsorbable threads under the surface of the skin to correct sagging in the cheeks, eyebrows, jawline, and neck, giving you gradual, sustained tissue regeneration by boosting natural collagen production, so your skin will become fuller and more youthful looking from within. It's beautifully effective. You can expect an instant difference with minimal downtime and long-lasting results. So why not book a consultation to discuss what's possible for you today?
Insertion point for inert injection is immediately lateral to the end of the mental crease. Insertion point medium
wished you could turn back time on sagging skin? Do you lift your cheeks or eyebrows in the bathroom mirror and wish they stayed that way? Introducing Silhouette Soft Thread Lift. Silhouette Soft patented thread lift technology delivers gravity-defying effects, repositioning sagging skin so you can say goodbye to the visible signs of aging. Following a consultation, your aesthetic expert will insert Silhouette Soft's reabsorbable threads under the surface of the skin to correct sagging in the cheeks, eyebrows, jawline, and neck, giving you gradual, sustained tissue regeneration by boosting natural collagen production, so your skin will become fuller and more youthful looking from within. It's beautifully effective. You can expect an instant difference with minimal downtime and long-lasting results. So why not book a consultation to discuss what's possible for you today?
Selamat malam dan selamat bergabung rekan-rekan sejawat sekalian dalam webinar persembahan dari Sinclair Indonesia yang berjudul Creating the Social Media Jawline by Combining HA Filler and Dynamic Contrast. Sebelumnya, saya atas nama Sinclair Indonesia mengucapkan terima kasih banyak pada dokter-dokter yang telah meluangkan waktunya di malam hari ini. Perkenalkan, nama saya Dr. Vina Wang. Saya trainer untuk Sinclair Indonesia yang akan menjadi host pada webinar malam hari ini. Telah hadir bersama-sama dengan kita Dr. Larry Wu yang akan menjadi narasumber kita pada malam hari ini. Izinkan saya menyapa beliau terlebih dahulu. Hi, Dr. Larry.
Good evening. How's everyone?
How are you?
I'm good, thank you. Hi from Singapore.
Yeah. It's nice to see you virtually, and thank you very much for taking time out of your busy schedule to share your knowledge with us. Okay, before we start the webinar, let me read the agenda first and your CV, of course, and then you may start after that. So, webinar nanti akan dimulai dengan pemaparan materi presentasi oleh Dr. Larry selama kurang lebih 20 menit. Nanti dilanjutkan video demo. Nah, selama presentasi, dokter-dokter dipersilahkan untuk menulis pertanyaan di kolom Q&A yang tersedia, yang nantinya akan dijawab langsung oleh Dr. Larry setelah presentasi selesai. Pertanyaan, dokter boleh tuliskan dalam bahasa Inggris maupun dalam bahasa Indonesia. Dokter-dokter dimohon untuk menuliskan nama jelas dokter di tiap pertanyaan, agar jika ada pertanyaan yang belum sempat terjawab, tim Sinclair Indonesia bisa menjawabnya melalui email. Oke, izinkan saya membacakan CV singkat Dr. Larry. Dr. Larry ini merupakan regional trainer untuk Sinclair untuk area Asia Pacific. Beliau juga founder untuk Eye Care Medical and Wellness Clinic di Singapura. Berikut adalah riwayat pendidikannya. Nah, tanpa berpanjang-panjang lagi, saya akan mempersilahkan Dr. Larry untuk memulai presentasi. Okay, Dr. Larry, now without further ado, let's start our webinar and you may start your presentation.
Good evening, everyone. I'm Dr. Larry Wu. I'm the Sinclair APAC trainer. I'd like to thank Jonathan and Karen for this opportunity to present in front of you. Thank you also for taking the time out this evening to attend this session on creating the social media jawline. So I understand that some of you do speak Bahasa. I'll try to speak as slowly and as clearly as possible. So the picture here is a picture of Egyptian Queen Nefertiti, whose name has been eternalized by the Nefertiti lift and is synonymous. Everybody knows this is how you go to every talk, you see this picture of Queen Nefertiti because it's synonymous with a beautiful jawline. Now, the Nefertiti lift was first described by Dr. Levy in 2007, and it includes injecting 20 units of botulinum toxin over the jawline and the platysma to cancel out the depressor effects of the platysma muscle. Now, it helps to define the jawline and soften the necklines without the need for surgery. Now, fast forward to 2023, 16 years later, what other advancements are there to help us create the jawline that's social media worthy? Next slide. So the following slide shows the content of my talk. I'll talk briefly about social media and its impact on aesthetics. Now, the factors to consider for a beautiful lower face, and also the filler that we are using today, which is the Perfectha and also its proprietary e-brid technology, and also the Silhouette Soft, another wonderful proprietary product from Sinclair. So starting from social media. Now, social media has indirectly dictated the trends in aesthetics. In fact, many doctors and aesthetic surgeons have created social media accounts to gain exposure for themselves and their skills in order to attract more customers. Now, social media has in fact become more ubiquitous and more common in society with an increasing number of daily users across multiple platforms. In fact, if you look at Facebook, it has an active user base of 2 billion, that's billion with a B, and Instagram with an active user base of 1 billion has permeated aesthetic medicine. In fact, a recent American Academy of Facial Plastic and Reconstructive Surgery survey reported that actually 42% of patients actually seek to see their specialists or their aesthetic doctors just to improve their appearance on social media. So, cosmetics. So why is social media so pervasive? So cosmetic surgery such as Brazilian butt lift has been popularized by the social media platforms such as TikTok. In fact, if you look at the handle #BBL, it has garnered in fact 2.9 million views. So why is social media so powerful? In fact, social media acts as a visual megaphone. Now, it works on the premise that human beings are not always rational, and we make calculations based on the perceived norms and their associated benefits. So women may subject themselves to dangerous cosmetic procedures such as Brazilian butt lift. And mind you, it has a mortality rate of 1 in 3,000. That means for every 3,000 patients who undergo the Brazilian butt lift, one person can actually potentially pass away from fat embolism. But why are women doing this? Because number one, they believe that by doing this, that actually increases social media has led them to believe that by doing this, it actually leads to social and financial success. And number two, because their friends are all doing it, it becomes a norm. And also, hopefully, the benefits will outweigh the risk. You can imagine if your social media following increases, you get sponsorships, you can hopefully translate into financial rewards later. Next slide. So this image of Ariana Grande has inspired millions of girls to go out there to get a jawline like her. So let's analyze why is this picture youthful? Now, the hallmark of a youthful face includes a smooth transition from the cheek to the chin, and there's absence of the marionette line, okay, and there's absence of submental fullness, okay, just pointing at the chin there, okay, and the jawline is also well defined with a curvy linear shadow that's causing from the anterior chin to the mandibular angle. In fact, the youthful jawline is very much dependent on having adequate bone foundation to provide sufficient volume at the prejowl sulcus. If you look at it, it's at the lip, just below the lip area, and also the angle of the mandible. So if you press on the click a little bit, so on the oblique view, you can see that there's a jawline, if the oblique jawline actually has a hockey stick configuration.
Dr. Larry?
Yes, next slide. Yes.
Would you please pause for a while? I think the screen is not moving to where you are.
All right. Okay.
Hang on, which slides are you in right now?
I'm the one with all the handsome men now.
Okay, we are still looking at the butt. So hang on a while.
Okay.
Are you seeing the screen that you are speaking right now?
Yeah, I am. I'm seeing the one on Chris Hemsworth.
No, we are seeing the hashtag jawline.
Yeah, we are seeing the Ariana Grande. Maybe please.
Oh, so it'll be a
we can
few
go
slides
next.
down. Slide 5.
Yeah. Okay.
Okay. You see
All right.
that?
Yeah.
Okay.
Yes.
So
Thank you.
I'm so sorry about that. So we'll talk about okay, so what are the ideal jawlines for a male? So we talked just earlier, we talked about female, now we talk about males. Now, male attractiveness is all about attaining the masculine ideal that evokes strength through desirable features, such as a well-defined jawline, as well as high cheekbones, and as well as a pronounced chin. In fact, if you look at the picture over here, Marcinkowski from the Nature Journal has shown that a sharp male jawline gives them more sex appeal by denoting higher level of testosterone and also a stronger immune system. Now, the results of Marcinkowski actually mentioned that women actually prefer men with a more masculine face, especially under conditions where childbirth is actually more conducive. That means when women who are looking for mates or who they are hoping to have children, they tend to look for men with a more masculine jawline and more powerful jawline. And also when there's a bit more money, they tend to look for men with more masculine jawline. So it's therefore unsurprising that why many men are opting to visually enhance their jawline and just to attract more females. Next slide. Yeah, can you see this? Next slide. So this is the next slide with the 4 things. So the lower third of the face complements the overall beautiful face. In fact, a well-contoured jawline gives the perception of beauty as well as youth. So in order to have a beautiful lower face, you need to, number 1, consider a beautiful jawline. Number 2, the absence of neck laxity, the absence of marionette line, as well as a beautiful pair of lips to complement it. Next slide. So talking about the lower jawline, the mandible is the biggest bone in the human skull, forming the bulk of the lower jawline. And in fact, it is shaping the contour of the inferior third of the face. If you analyze the mandible, it undergoes an anterior-inferior resorption, which can be further aggravated by the loss of teeth. That's why if you look at your elderly grandparents, they tend to have a very short mandible because they have lost a lot of their teeth. And if you analyze the gonio angle, so if you look back at the skull itself, you look at the angle of the jawline, you can see that it's increased from a more acute of 90 to 100 degrees to a more obtuse 120 to 150 degrees as a result of bone absorption. Now, these changes together with skin atrophy results in loss of jawline definition as well as formation of jowls. In addition, because of the loss of jawline and bone stock, you also have to consider that the muscles such as depressor labia inferioris, depressor angularis oris, as well as platysma muscles also further contribute to the pull of gravity and further contributes to the blunting of the jawline. Next slide. Now, when you're rejuvenating the lower face, it's recommended to understand the anatomy of this region. Now, let's go through the slide. So this is a cadaveric dissection. So if you look at it, the first one is where the skin is actually being folded back, showing the superficial fat and superficial muscular aponeurotic system. And then if you start folding back the superficial muscular aponeurotic and the superficial fat system, you can see that this one in red. Allow me to orientate you. This is the superficial temporal artery. And then if you look at the next dissection, the red color is due to superficial temporal artery. The dark gray, you can see the most superiorly, second most superiorly, that's where the parotid gland is. The yellow one is the masseter muscle, the facial vein, which is in blue, the facial artery, which is in white, okay, and the platysma muscle that's in light gray, and the green color is the buccal fat. So just remember this configuration. The facial vein is behind the facial artery. Okay, now we're gonna. So it's only when you understand the anatomy of this region, you can start giving patients such a beautiful jawline safely. So to understand the lower jaw anatomy, I've prepared an ultrasound video demonstrating the muscular and the vascular anatomy of this area. Now, if I can draw your attention to the first picture on the left, now you can see that there's a double asterisk sign, and there's a hypoechoic region, and that's where the bone is, because bone reflects back ultrasound. That's why it appears hypoechoic. Now, this is where the mandible down here, and if I can show you, orientate you to the picture where there's an ultrasound probe. Okay, now this is how we hold the ultrasound probe at the lower jawline, parallel to the jawline itself. So you can see where the bone is, just on top of it is where the masseter muscle is. So if you look at the picture itself, the masseter muscle, okay, and then on top of it, okay, that's where the parotid gland is. And then if you see there's an arrow, so if you go back to the ultrasound picture, if you see there's an arrow, it's pointing to where the facial artery is. Now, if I can play the video, can you play the video for us? Now, this is actually a video of my masseter muscle. You can see that as I bunch up and as I crunch my teeth, you can see that my masseter muscle is actually moving. Okay, muscle is actually becoming thicker itself. So it shows that where the masseter muscle is. Now, next slide. Okay, now, so after seeing the video, now if you pay attention to this, now if you look at the red and the blue, okay, now I have to tell you that if you look at the ultrasound itself, now the red we know is always points to artery, but not in the sense of ultrasound. When the fluid is moving towards the transducer, it is actually red. Fluid that's moving away from the transducer, that is actually blue. So remember the dissection earlier? In fact, I put a picture here to show that the facial vein is actually behind. So if you look at where the masseter muscle is, the one in red is actually where the facial vein is, and anteriorly is where the facial artery is. Now, can you play my video? You can see that there are two pulsating things in there. Can you play my video, please? Now, you can see that if you play the video, now the one that is pulsating away has got turbulent flow. That's why it's got a mixture of both red and blue, indicating it's actually artery, whereas the facial vein is generally very quiescent. So there's actually only one color to it. Okay. Okay, next slide. So to understand how the lower face ages, well, I also need to explain the superficial muscular aponeurotic system, now, which is short form for SMAS. So the SMAS is actually an organized fibrous network that's composed of inferiorly the platysma muscle, the parotid fascia, and also a fibromuscular layer that's covering the cheek. Now, the SMAS layer was first described by Mitz and Peroni in 1976. Now, if you look at the SMAS layer, it is continuous superiorly with the temporal parietal fascia, or some people call the superficial temporal fascia, and inferiorly, it is continuously with the platysma. Now, the SMAS tend to attenuate as it travels medially to the midface. In fact, it terminates on the lateral border of the zygomaticus major. So if you go to the front, there's oblique muscle, that's where the zygomaticus major is. Now, if I can draw your attention to the pictures over here for those ladies, you can see that laterally, the SMAS tend to be laterally more fixed, whereas more anterior medially is relatively more mobile. So this allows the fat to slide inferiorly down. And this gives you that classical configuration where the lateral cheek is actually being scalloped out. Okay, the posterior cheek is being scalloped out inferiorly. There's actually a lump, there's a jowl that's actually coming down. Now, directly in front of a jowl, there's also where the mandibular ligament is. Now, it's actually a true osteocutaneous ligament. So the mandibular ligament, as you know, a true cutaneous ligament, they tend to start from the periosteum, and as it reaches the SMAS, it apparizes and inserts into the dermis. So anteriorly, the fat pad is actually prevented from sliding forward from the mandibular ligament. So to summarize, you can see that over here, if you look at the jawline for the first lady on top, there's a scallop out shape and then followed by jowling, okay? And then anteriorly, you can see the Marinette line. And that explains why, if you look at how a lot of these old ladies, you can see this very classical aging appearance. Okay, so later I will explain how we can actually help to address this in a patient. So the next slide. So now we are moving from the back of the jaw to the front of the jaw. So anteriorly, you can see that the mandibular ligament is actually attached to the posterior border of the depressor angular oris, which is actually a triangular shaped muscle over there. Now, if I draw your attention to the cartoon, now, in patients with type 2 with mandibular hypoplasia, that means chin is smaller, or we have type 2 underbite. Now, this causes the hyperactivity of the mentalis muscle and as well as the hyperactivity of this triangular shaped muscle that I told you earlier, and causing the corner of mouth to put downwards, giving them a very unhappy looking face even when they are resting. So next slide. Now, so we've moved from the back anteriorly, now we are moving down. So in the neck, okay, there's a group of ligaments called the cervical retaining ligaments, which is found at the posterior junction of the platysma muscle at this junction of the sternocleidomastoid, which is this oblique shaped muscle over here. Now, the function of the cervical retaining ligament is to tether the platysma to the deep cervical fascia along the angle of the mandible and also along the anterior border of the sternocleidomastoid. So you have your retaining ligaments in the face, and you have retaining ligaments in the neck that tend to help you prevent your neck from aging. So it helps to prevent your neck from flopping down, but also when you're treating them, when you're treating the neck for a neck lifting later, this cervical retaining ligament also restricts the attend that you can treat with your threads later. So next slide. Okay, now we've moved downwards, now we've moved upwards. So don't forget, when you're treating a lower face, it's also very important to rejuvenate the lips as well. Now, the hallmark of lip aging is the loss of collagen. So if I refer you to the first cartoon, so the loss of collagen results in the effacement of the cupid's bow. You can see this nice M McDonald's shape that's being blunted out, the loss of the distinction between the vermilion border. Now, in addition to loss of volume, there's also presence of lines, the barcodes along the mouth, also called the perioral wrinkles. Now, when you're rejuvenating the lips, it's very important to be aware of where the arterial anatomy is. Now, we are aware that 75% of the artery is submucosa, okay? If you look at the last picture, 75% are that submucosa, 25% is intramuscular, and also up to about 1% is actually subcutaneous. So 1% is subcutaneous. The safest area to treat will be in the subcutaneous area. Okay, next slide. So this slide summarizes exactly what I've mentioned about the components of desirable jawline. Includes number one, an adequate bone volume, okay, of the mandible, because it forms the bulk of the lower face. And you also have to pay attention to the gonio angle, chin projection. You have to pay attention to the lips, and you also have to pay attention to the depressor angular oris muscle. And you also have to address the skin laxity. The vascular structure-wise, you have to pay attention to the position of the facial artery and the vein. And also there's another artery called the submental artery, which will come across later, which is a branch of the facial artery. It causes here to the anteriorly over the chin is. And also, lastly, you'll be aware of this nerve. Now, if you look at this picture, it's trying to show you this yellow colored nerve, which is a branch of the facial nerve. It crosses along the angle of the jawline, and then it crosses the mandible. Now, you shouldn't reach this marginal mandibular nerve because it's definitely below the platysma. So if you treat it properly, you shouldn't come across this nerve at all. Okay, so after going through the factors to consider for a beautiful lower face, now let's talk about the wonderful range of Sinclair. Next slide, sorry. After talking about the anatomy, the factors to consider for a lower face, let's talk about the wonderful range of Sinclair products that can exist in creating that beautiful jawline. Now, next slide. So the Perfectha is a range of absorbable hyaluronic acid gel implant that's based on the e-brick technology. Now, it's intended for facial rejuvenation and is usually indicated for treatment of the nasolabial fold, the chin, the lips, and as well as the mid-cheek. Now, Perfectha is manufactured 100% in Lyon, France by Sinclair France, and it has the ISO certification since 2007. So, during the manufacture of the Perfectha filler, BDDE is added to highly purified hyaluronic acid. So if I draw your attention to the left upper border, you can see this very nice and smooth hyaluronic acid. Following the addition of BDDE, it becomes these microgel particles. And this is where they start forming. So after adding BDDE, it allows the formation of covalent bond and becomes these microgel particles. But if you look at it microscopically, it becomes a macromolecular network. Okay, now these microgel particles are then added to a HA polymer solution to form a multi-structural connective network. Now, this HA polymer solution acts as a protective fluid environment that confers mobility to the microgel particles to make sure that there's ease of injection and there is not much of clumping of the fillers. You'll find that if you ever come across a Perfectha filler, there's extrusion force. It's actually very minimal. So this is the highlight of the Perfectha range. So in this multi-structured connective network, number one, you have your next slide. Okay, you have number one, your macromolecular. So this is the multi-structured connective network. You have your macromolecular network. Okay, and then with the HA polymer and also the interfascial network. Okay, next slide. Do you see all the fillers here? So based on eBrick technology, there are 4 different fillers that are being created. Number one, that's the fine line range, and then the derm, then the deep, and the subskin. Now, the viscosity of the fillers and the contents of the HA contents are all the same, 20 milligrams per milliliter of filler. That's the beauty of it. And the G prime, which is the lifting capacity, is entirely dependent on the macromolecular network that we showed you earlier. So what I'm trying to say is the HA content is exactly the same. This is the best part. However, the G prime is entirely due to the size of the macromolecular gel particles. So just going into greater details of the 4 different types, you have your fine lines, okay, which you can, next slide, are you at the green slide, the fine lines? Okay, so you have fine lines, which is for correction of the tear trough, also the fine perioral area, and also at the crow's feet. Okay, next slide, you should see a blue, which is for Perfectha derm. Okay, it's indicated for your nasolabial fold, lips, and forehead. Okay, then you can start seeing a pink range, which is a Perfectha deep. Now, this is indicated for nose and also for mid-cheek area. Okay, next slide, which is a Perfectha subskin. Now, this is the most robust range of filler and is indicated for jawline rejuvenation, something they want to have more oomph, something a bit more projection. So you use Perfectha subskin. So they'll be used for jawline rejuvenation, nose projection, and also to treat your zygoma also. Okay, so moving on to the next slide, you should see a cartoon here. So the 4 different ranges, you can see that yellow is the deep subskin, which is super periosteum. Deep, which is deep subcutaneous, which is the pink color. The blue color, which is derm, which is superficial subcutaneous, and you see the fine lines, which is in the dermis itself. So these are approximately the layers where you'll be injecting your Perfectha range of filler. So next slide. So you start seeing. So the discussion of the Perfectha range of filler will be incomplete without the discussion of the 3PF technique, which is described by Dr. Remy Haidar, maxillofacial surgeon. So if you look at the first picture, it describes a series of injections that allows treatment of the face with the least amount of entry point. So in the 3PF technique, the 3 means that 3 entry points in the upper face. Can you play the video for the first one, the first picture? In the upper face, it describes a point of entry. If you mark it at 1 centimeter from the orbital margin, and then you draw a line intersecting upwards, okay, where it intersects with the temporal crest, you drop down 1 cm. Okay, this is a point of entry. So you can use a Perfectha derm or Perfectha subskin or Perfectha deep and deposit about 0.1 to 0.5 mils to rejuvenate the temple. And then using the same entry point, you can change to a cannula. Can you play the second video? So you can use the same entry point and help you treat your retroapicularis oculi fat, the roof fat, and also to help you perform your brow lift to make the patient look more feminine. Okay, so this is the 3PF technique. So this is for the upper part. Now for the mid face. Okay, so for the mid face, if you draw from the lateral orbital, the lateral canthal margin, you drop down 1 cm. That's a point of entry for the midpoint. You can use it for injection above the zygoma itself, okay, to cause a bit of cheek lift. And also you can use a cannula for that point to help you rejuvenate the malar, the mid-cheek area, the zygomatic arch also, and the nasolabial fold itself also. Now we're going to move on to the next slide. For the lower face, the 3PF technique, you find a point, if it's a midpoint between the chin and the gonial angle, you go in there with a cannula, and then you can use it to address your meridional line and also gonial angle, and also you can use it to create a chin projection also. So next slide. So that's a brief introduction of the Perfectha e-braid range of filler. Then we're going to talk about the Silhouette Soft, which is a proprietary thread and cone technology that is exclusively from Sinclair. So what is Silhouette Soft? Now, Silhouette Soft is an innovative thread lift device that's made of, so next slide, we have the Silhouette Soft. It's an innovative thread lift device that's made of 3O PLLA monofilament with intercalated polylactic co-glycolic acid hollow cones. Now, it's unique in the thread treatment because it has an anchoring as well as repositioning side, meaning this is not a free-floating thread at all. So next slide. So it has the wonderful thing about the Silhouette Soft thread is that it's got dual mode of action. It has an innovative bidirectional cone technology that allows, number one, instant repositioning of the mobile fat tissue that provides a strong fixation to the rigid tissue. And also it provides gradual tissue regeneration through the gradual breakdown of the PLLA threads. So if you look at next slide, if you look at this picture, so the indications for silhouette is number one, on top it will be for a thread lift. For the mid face, it will be for mid-face ptosis. The lower face will be for marionette line, and also for the bottom part, it will be for your neck lift. Okay, next slide. So if you look carefully at the thread lift device, it has two trocars to allow the thread to be inserted. And let's pay attention to the hollow cones, which are separated by tie knots. So the knots will keep the knots will prevent the cones from sliding, and because the cones are really great at catching tissue, it allows a really rigid tissue fixation. Next slide. So what are the ranges in the Silhouette Soft? It has 4 different units. Number one, from 8 cones, 12 cones, and the 12 cone short, which is my personal favorite, and also the 16 cone for different requirements. So this is a cadaveric pull-out study that you can find, with the reference that next slide. So this is a cadaveric pull-out study. So if I draw your attention to this first row, which is the Silhouette Soft. Now, if you look at the pull-out force, it's got 9.5 newtons of force. Okay, so roughly every thread that inserts tissue, it gives you approximately almost 1 kilogram worth of lift. So one side, if you can put in 5 threads, it theoretically should give you 5 kilograms worth of lifting capacity. That is quite sufficient for most faces. So next slide. So let's talk briefly of the 12 cone short, which is the latest addition to the Silhouette Soft range. It is developed in response to physicians' requests for better and more powerful lifting threads. Next slide. The increased cone density means that there's greater lift capacity, and also for more enhanced lift, and there's greater precision. The greater number of cones per cm allows greater dispersion of force, and hence there's less evidence of palpable tissue compression. So if you use the 12 cone shot, you'll find that after you've done the tissue compression, it's actually very, very smooth. So let's talk about combine. So in this technique that I use, I'm introducing later. So we use a silhouette strictly for neck lift procedure. So our marking is from the midline itself. We start 0.5 centimeters for the repositioning side, and 0.5 centimeters from midline, and you measure 0.5 centimeters, and that's when you put in, that's where you enter your 18G cannula trocar, and then from there you put in your threads. So just to see, so if you look at this slide, are we at the neck lift protocol? So if you look at the red line, okay, the midline is where, midline you start 0.5 centimeters from the side, it measures 7.5 centimeters, and that's where you enter and put in your cannula, okay? And then the exit is where the mastoid region is for greater fixation. Okay, let's go on to the next slide. Can you play this video? So this video shows the insertion of the 12 cone shot. So we have used iodine for cleansing, and then I'm showing you exactly where the markings are. We start 0.5 centimeters from midline and measure 7.5 centimeters. We put it in, and then once the trocar is in, when the black mark disappears, we level it out, and then we advance the trocar. Now, if you see that when we maintain, there is no pulling at all. All it is just maintaining traction, and then you slide the tissue backwards. There is absolutely no pulling, because when you pull, they can potentially cause this thread itself to snap. And then you do the same thing for posteriorly, and then you exit through, you go through the platysmal auricular ligament and exit through the mastoid cavity, the mastoid fascia. Okay, so next slide. So here I'm going to present a patient that's just strictly rejuvenating for the lower line using the Perfectha Lido range. Next slide. Okay. Okay, next slide. So are we seeing this patient already? So this is our first patient using the Perfectha Lido range. Now this is a 36-year-old mother of two who complained of feeling tired. And she also complained that her face looks very broad. So if you examine her, if you pay attention to her lower face, she's got a shorter lower third of the face. She has some degree of chin protrusion, and as well as lack of jawline definition from the side view itself. Okay, next slide. So when we get her to pout her lip, now she has got this classical, if you look at the first picture, she's got classical cobblestone appearance on the chin due to overactive mentalis. And if you do the side, okay, then you press on the click, you should start seeing a thing coming out. Now, if you go by the Ricketts line assessment, do you see a line that's coming from the tip of the nose all the way to the lip? And you can see that she's got some degree of protrusion. If you base on Ricketts line's assessment, you can find that the chin doesn't really touch the line itself, telling us that she's got some degree of chin protrusion as well. Okay, so for this lady, we use 6 mils of Perfectha subskin. And also for all my patients, we try to improve the skin texture also. And this is her following treatment using 6 mils of Perfectha subskin. You can see that her face appears slimmer. Now, this is not because we have done anything to the zygoma itself, but all we have done is to just give a little bit of chin lengthening, okay, to give by injecting filler, and proportionally, she looks slimmer just by adding to her chin itself. If you look at the side view, she's got much more well-defined jawline. She's got nice chin projection, and as well as a more, if you look at the back here, she's got more prominent gonio angle as well. Okay, next slide. So if you play the first, so this is the injection. So next slide, are we at the cadaveric slide already, where we're doing the injection in the area just before the ear? So well, we introduce a filler using the cannula, okay? And remember earlier we mentioned about this thing called sexual dimorphism. The difference between the treatment between a man and a woman is that for male injection, we want a vertical mandibular pillar. For a lady, we want it to be nice, broad shape, because we don't want the bigonial diameter, bigonial width to be almost the same as bizygomatic, because for a man, the bizygomatic width is almost the same as the bitemporal width. So we want it to be a little bit slimmer, so they give her a nice oval shaped face. So just remember, for a lady, we're treating it, can you play the video? When we treat, we want to give a nice, broad, fan shape. So we don't want to make her too masculine by giving her a very powerful mandibular pillar. Now, the plane of injection is deep subcutaneous, and also we use a retrograde injection. Now, next slide. Okay, this one you should start seeing injection. We're treating the marinette area. We use cannula. Our point of entry is behind the marinette line itself. Okay, we like this technique because it allows fats to be deposited in the deep subcutaneous compartment. And also, if you following treatment of the mandibular marinette line, you can slide your cannula upwards and give a little bit of lip support to give her a slightly smiley face. Okay, next slide. Okay, now, so we have treated the back of the cheek, we have treated the marinette line, now we're going to go to the chin area. So now, so the chin area, that gives us two areas, we have two potential planes to treat. Either deep supraperiosteum and also superficial subcutaneous fat, okay? Now, if you look at this, the third cadaveric dissection, you can see that there are two blobs of gel in there. One is in the supraperiosteum, deep on the bone, and the other one is superficial subcutaneous. Now, if you go lower down in the dissection, I'd like to draw your attention to this submental artery. So the submental artery, which is a branch of the facial artery, angles over where the parallel to the jawline, and it ascends over to the chin area. So can you play the video of the ultrasound? Now, this is trying to show you where the submental artery is. Okay, so we have treated the chin area. Now, when you're treating a chin, it's very important to aspirate for 7 seconds, just to prevent yourself, just in case you have skewered this artery. Make sure 7 seconds, there's no blood positive aspiration, then you can do the injections. Because if you have inadvertently caused any bruising injection here, it can either cause bruising, or sometimes it can cause tongue necrosis because of blockages of the submental artery, because sometimes it does have a connection into artery which supplies the neck and the tongue itself. Okay, next slide. Now let's go on to the lip. So remember, for the lower face, there's the lip also. Now, so the lip that we are treating, we prefer to use the tenting technique. Now, earlier I mentioned to you about the statistics for the lip itself. For the superior labial artery, 74% is in the submucosa, 24% is intramuscular, and also 1% is subcutaneous. Now, can you play the first ultrasound video? Now, are you playing the ultrasound video? Now you can see that there's a hypoechoic region down there, and that's where we're putting ultrasound on the lip itself. Okay, the hypoechoic thing is where the teeth is. On top of it is orbicularis oculi, and you can see that there is shadowing. There's actually vessels on top and below, and you can see that this shadow is actually passing through the intramuscular area. So you can see that over here. Remember, for the lip anatomy, the vascular anatomy in the lip, it becomes very unpredictable. So it becomes very hard to find out where exactly the artery is. That's why it's important to stay in the subcutaneous area. Now, if you play the next video, now the next video shows where the facial artery is coming up, ascending from the corner of the mouth itself, past the modulus, and is sending up a branch in the superior labial artery. So it's important when you start injecting to be a bit closer to where the corner of the mouth is, rather than being too far out, because you can inadvertently skewer the superior labial artery as well. Okay, next slide. Okay, so this is the total number that we have used. So we've used 6 mils of subskin, and 1 mil of perfected derm. So next slide. So for certain patients, just using fillers alone might be able to give you that nice, beautiful jawline. Okay, now the next I'd like to show my technique of combining the Silhouette Soft 12-cone shot with Perfectha Subskin for jawline rejuvenation. Now, this combined technique will help address the issue of neck aging due to indistinct mandibular border, and also you will find that the technique is much more better compared to just fillers alone. So next slide. So now the typical appearance of the aging jawline is caused by changes in both the heredity as well as the aging process. Now, every patient will demonstrate different anatomical factors that contribute to the overall appearance of aging jawline. And also, you can imagine for our neck itself, it's actually a very loose piece of skin, and some people do turn their neck up to hundreds of times a day. And because of this, you tend to accelerate your aging process. Okay, next slide. Now, this is the result of a patient that have just rejuvenated the chin, the lower face, with 6 mils of high G prime filler. Yes, he's a Caucasian man. Yes, you can see some degree of chin lengthening. Yes, you can see some degree of more defined jawline. However, there's the issue of submental skin laxity. If I draw your attention to the lower chin itself, you can see that even though we've introduced 6 mils of filler, the lower chin itself is still inadequately, the lower neck is still inadequately rejuvenated. Okay, and the result tends to be suboptimal. the patients can't really see that results that well. Even though we as doctors, we can see it. Unfortunately, the most important thing is the patients after paying 6 mils of filler, they have to be able to see it. Okay, now next slide. Now I'd like to introduce you to this classification that I like to use is a classification of the aging of the neck by Dr. Dido. It classifies the aging neck into 6 different types. Type 1, when there's minimal skin laxity. Okay, if you look at type 2, is when there's some degree of neck laxity. If I draw attention to type 3, some patients have excess amount of submental fat itself. Okay, and sometimes they got a prominent submandibular gland over here that you can see in type 3. Type 4 is when patients have got prominent platysma banding. You see patients with prominent platysma banding. If you identify that, then you have to treat it with your botulinum toxin around there. Type 5 is when patients with smaller chin that either have retronathia or microgenia with a small chin itself. And type 6 is when patients have a low riding hyoid. This makes it very, very challenging to rejuvenate the neck itself. So this is a very simple picture to help us identify what are the deficiencies in the lower half of the neck. So for example, if the patient has excessive amount of fat, there are some things you can do to help you reduce the excessive amount of fat. If the patient has slightly smaller chin, then you need to put more resources and defining to give them a much nicer chin itself. Okay, next slide. Now, remember the type 3 classification? I mentioned there are some degrees excessive amount of fat. Now, for the submental fat, it's important to identify who are the patients with subplatysma fat and also preplatysma fat. Now, how do you differentiate between them? You put your finger and you pinch the fat itself. Now, if you were to clench your jaw, okay, you pinch the fat tissue, you clench your jaw, and then if the fat escapes out from your fingers, it tells us that these are subplatysma fat. It means that they are inside the platysma, they are into the jaw itself. Whereas if you pinch the fat and you clench it and the fat remains in your hands, now these are all preplatysma fat. This one you can either melt it away or do liposuction, and that will give you really good results. And also, sometimes you identify where patients got submandibular gland hypertrophy, because this can also distort your jawline. Okay, now next slide. Now, I'd like to draw your attention to this dissection, because I think this is very, very important. Now, if you pay attention to the anterior half of the jawline itself, now can you play this video? Now, the anterior half of the jawline itself, where the depressor angular oris is, that part of platysma is relatively fixed. However, the posterior half of the platysma tend to be relatively more mobile. You can see that the patient is actually moving the jaw itself. Now, for a patient who has a relatively mobile platysma that's sliding over here, even if you put 5 or 6 mils of filler along the jawline, you're not going to get really nice results. Just remember, let me highlight the Caucasian man that I mentioned to you earlier. Your patient has a really loose area, and that's exactly what happens to me when I put in 6 mils of high G prime filler. You get suboptimal chin rejuvenation. Okay, so how do we address this area? How do you address this problem? Okay, next slide. Okay, so we combine the chin, the thread. Okay, we put in the thread lift itself, and then followed by the affected subskin. And this is the patients following exactly that method of treatment. Okay, you can see that following insertion of your 12-cone shot, you can find that the neck is appearing to be a bit slimmer, and put in some chin filler. You can see that she's got much nicer jawline definition, and also improved submental angle following this cervical mental angle following treatment with the threads itself. Okay, and also putting in the chin filler as well. Okay, next slide. So this is another lady who has undergone chin reduction. Okay, so she's gone to Korea to remove part of her gonio angle. Okay, initially, when she was younger, because she thought that was a good idea. However, as she grows older, you can notice that she's starting to have some degree of submental fullness, and she's complaining of lack of well-defined jawline. So using the silhouette neck lift technique by putting in two 12-cone shot per side, and then using a little bit of filler, and also we use a bit of lid filler for her, and also we use subskin for her nasolabial fold. You can see that we give her a much more desirable lower jawline for her. Okay, can you see that the last picture itself? If you appreciate the neck appearance and also the improvement in the absence of submental fullness, and also improvement in the cervical mental fullness. Okay, next slide. Okay, now this is a girl from my clinic. So she's a young girl with some degree of chin protrusion. So we've used 4 silhouette soft, 12-cone shot, also 4 valves of Perfectha Deep for jawline creation. You can see that following treatment, she's got much more well-defined jawline and also a nicer degree of chin projection. And most importantly, her jawline looks slightly more attractive, and she doesn't have that the corner of the mouth that's pulling it down anymore. Next slide. Now, so this is in the male patients. In case you're wondering if this technique applies to male also. So this are we at the male gentleman slide? So this gentleman walked into our clinic complaining that he's got a blunted jawline, and he actually wants a more prominent jawline because he wants to look, to have a bit more appearance of leadership, because we know that you mentioned earlier, a more masculine jawline, a more well-defined jawline tend to correspond to a more masculine shape. So we're saying we use 4 silhouette soft 12-cone shot per side and followed by Perfectah subskin, and you can find that he's got a much more well-defined jawline, and most importantly, the patient likes it a lot following that. Okay, so we'll move on to the next slide. So you see, can you play the video of this nice, beautiful girl here? So a beautiful lower face. So if you do it right, okay, there's a nice, beautiful lower face. Includes absence of a marionette line, a beautiful pair of lips to complement that beautiful jawline. So if you rejuvenate your patients properly, you should get something like that. This nice, beautiful girl that's just walking around. Are you playing the video? Okay, next slide. So in summary, okay, the neck and the lower face are often neglected in favor of treatment of upper face. However, if the jawline is loose and saggy, it will not complement a beautiful face. So to summarize, to create a social media jawline requires a detailed analysis of the mandible, including the gonio angle as well as the chin projection, and also to perfect a lido range provides a comprehensive range of filler based on hybrid technology that can suit all your aesthetic needs, and also the Silhouette Soft can effectively address the jowls and also the marionette line using the Silhouette Soft neck lift technique. Thank you very much. End of presentation.
Wow. Thank you very much, Dr. Larry, for a very enlightening and entertaining presentation. And now we're going to the Q&A session. There are a few incoming questions. I will read it for you. Okay. First one. Okay. If the patients need a thread lift and filler treatment on the jawline, which one do you do first? The thread lift first or the filler first?
So when patients come in, usually I get them to do both together, and that's a very good question. So I demonstrated to you earlier that the patients, by using the thread lift, can give a much lower, better jaw definition, because when you do the thread lift, you can imagine a tablecloth. you'll be like folding a tablecloth underneath the table to give you a nice definition. Now, the requirements for sterility for a thread is definitely higher. So if I have to do, I'll definitely do the thread lift first, okay, making sure that everything is clean, sterilize everything, and I can put on sterile glove for it. Put in the threads first, and then followed by the fillers. Now, when you're putting in the threads, there's a special position. I would like to put the pillow behind the back so that you hyperextend the neck to make it easier for yourself to put in the threads itself. So in summary, you usually put in the threads first just because the requirement for sterilizing, it requires a greater degree of sterility, and then followed by the fillers itself. And also by putting in the thread, it gives you the nicer jawline definition, and then you will know where to put in your threads more accurately. Because if you put in your threads, you put in your fillers first, and then you follow by filler, you might not be able to have such nice definition. Thank you.
Okay, Dr. Larry, I will translate it first to Indonesia. Tadi ada pertanyaan, Dok, dari participants di sini. Pertanyaannya adalah jikalau pasien tersebut pada area jawline-nya memerlukan treatment thread lift dan filler, mana yang terlebih dahulu dilakukan. Tadi Dr. Larry menjawab kalau beliau biasanya kalau perlu dilakukan pada waktu yang bersamaan, biasanya dilakukan thread lift terlebih dahulu, baru setelah itu filler dengan berbagai alasan. Ya, salah satunya tadi setelah dirapihkan lebih mudah kita untuk mempertegas bentuk jawline-nya, dan juga yang kedua adalah mungkin ada kesterilan kesterilan dulu terlebih dahulu, karena kan pada saat mengerjakan benang kita perlu tindakan yang steril. Nah, setelahnya baru kita bisa lakukan filler. Oke, pertanyaan selanjutnya. Oke. Oke, ini ada pertanyaan mengenai silhouette soft. Okay, so Dr. Larry, for the next question, so if the patient has a double chin, when do you use the hammock technique? It's for the silhouette or the lateral entry technique?
So for patients with prominent double chin, so that'll be what we call the type 3 neck. So first of all, what you do is you assess the degree of platysmal fat, whether this is a subplatysmal or preplatysmal fat. So by pinching it, you'll roughly know if the patient has excessive amount of preplatysmal fat. There are some things they can do to help you reduce the amount of fat itself, and then followed by your hammock lift technique. So the things that we recommend are, for example, if you have access to deoxycholic acid or high intensity focused ultrasound. Personally, I prefer to use deoxycholic acid and then followed by there's actually a special sling that you can get the patient to wear, and then following this treatment, usually a month later, you can start doing your thread lift technique, and it gets a much nicer result, just because there's less fat for you to lift. So in summary, think of some things to melt the fat first, and then do your thread lift technique. So the hammock technique will be more suitable. Thank you.
And sorry, so
get rid of the fat first.
Okay, so what kind of patients are you using the lateral technique silhouette? So when you're using the hammock and when you're using the lateral technique,
when it's not too severe, then usually I'll use the lateral entry technique. For patients who are quite severe, I'll definitely melt the fat first and then use the hammock technique.
Okay, thank you very much. I'm going to translate it. Tadi ada pertanyaan kapan untuk thread menggunakan benang siluet pada area double chin, kapan menggunakan hammock teknik yang dari tengah atau menggunakan lateral teknik, jadi teknik yang ditarik ke samping. Tadi Dr. Larry menjawab, biasa kita bisa cek dulu tadi platysma fat-nya, lemak di area sininya. Nah, kalau misalnya banyak free platysma fat, disarankan menggunakan hammock teknik. Tapi sebelumnya Dr. Larry menyarankan kita untuk melakukan treatment lipolisis terlebih dahulu atau misalnya lebih dikenal dengan nama mesolipo. Dan beliau biasanya menggunakan deoxycholic acid untuk mereduce si fatnya, baru setelah itu dilakukan thread lift. Nah, untuk lateral approach atau dari samping biasanya itu dilakukan pada pasien-pasien di mana tadi tidak terlalu besar free platysmal fatnya, jadi bisa ditarik ke belakang. Oke. Saya akan lanjut ke pertanyaan selanjutnya. So, Dr. Larry, I'm going to the next questions. Okay, in some occasion, thread can causing dimple. Can you fill that dimple with filler?
So the best treatment for dimple is actually prevention. So prevention is definitely much better than cure. So if you put in your thread itself, so once you see the black, when you introduce your trocar, once you see the black mark itself, you level it out. Okay, now, and also, so the best treatment is actually to prevent it. So when you put in your thread itself, do not pinch the tissue, just let it drop in, because once you pinch the tissue, you're distorting the tissue already. So you do not pinch the tissue, you just let your silhouette trocar drop in, and then once you see the black mark disappears, you level, and you do that for the other end. That's one of the best way to prevent it. So the best way to treat it is not to have it. Now, if you do have it, you can use either the 18G needle to do a little bit of subcision, and then followed by very low G prime, such as fine line filler. So yes, in summary, you can put some fillers inside, but the best is always to prevent it first.
Oke, thank you. I'll translate it. Jadi ada pertanyaan, Dok, bagaimana kalau ternyata pada saat pemasangan benang terjadi dimple atau seperti lesung pipit, ada cekung. Nah, tadi Dr. Larry menjelaskan tentu saja pencegahan adalah yang terbaik. Jadi mencegah dimple itu lebih baik tentunya. Nah, beliau memberikan beberapa tips untuk mencegah agar dimple itu terjadi. Yang pertama adalah pada saat kita memasukkan dari entry point. Nah, maksudnya salah satu superiority dari benang siluet adalah pada jarumnya itu di ujungnya terdapat mark warna hitam, itu menandakan kedalaman dokter untuk memasukkan si jarum itu sendiri. Jadi pastikan sampai kedalamannya hitam, sampai garis hitam, kedalamannya mencapai garis hitam tersebut, baru si jarum dimasukkan. Nah, setelah itu dokter disarankan untuk menghindari mencubit area yang akan dokter buat entry point. Karena pada saat mencubit akan terjadi pergeseran dari lapisan kulit dan lapisan bawahnya. Sehingga nanti pada entry point yang selanjutnya mungkin akan ada perbedaan lapisan sehingga terjadi dimple. Nah, lalu kalau misalkan sampai terjadi dimple, Dr. Larry menganjurkan untuk disubsidi dengan jarum 18G terlebih dahulu. Kalau tidak berhasil, bisa dilakukan pengisian tentu saja dengan filler Perfectha yang paling soft, biasanya karena kan dimple terjadi di permukaan. Filler Perfectha yang disarankan digunakan adalah filler Perfectha yang jenisnya fine lines. Okay, so the next questions. How about thread and filler retouch? Okay, so when if the patient has already done the treatment, filler and thread lift, so usually how long it will stay, or how long they need to do the retouch, both for filler or for thread lift?
So we know that the longevity of the Silhouette Soft should be 18 to 24 months. So we tell the patients that to come back, so maybe 18 to 24 months later to redo another touch-up again. And also, we do have a sling that I get the patient to wear to help them optimize the result. If you want to, we can show you what the sling looks like. So after I put in the thread lift, I usually get them to wear it because there's a lot of tissue edema, a lot of tissue swelling. So we just put in the tissue edema, and the swelling actually encourages, sometimes gets the thread to slide off. So we should get them to wear it. And also also to wear it as and when throughout the next 1 or 2 years. And we find that actually it helps to give them much nicer results. So if you combine this procedure, sometimes patients can have up to 24 months of good results. So to do it about 24 months later.
Okay, how about the filler?
The filler, now the Perfectha range of fillers can, depending on the range that you use, if you use subskin, it should give you up to 18 months of good results. So, but we know that if you do the trap properly, so even when the fillers are less prominent, it can still give you the results. So maybe about 18 to 24 months.
Okay, so ya tadi ada pertanyaan dok, kapan baiknya dilakukan treatment filler dan thread lift lanjutan setelah kita melakukan treatment yang pertama. Tadi disampaikan bahwa baik untuk thread lift itu akan bertahan kurang lebih 18 bulan sampai 2 tahun. Jadi biasanya kita meminta pasien untuk retouch kurang lebih 18 bulan setelah treatment. Lalu yang kedua tadi filler juga sama ya dok, untuk subskin. Subskin ini adalah yang paling keras sehingga biasanya juga tahan kurang lebih 18 sampai 24 bulan. Jadi biasanya 18 bulan atau kurang lebih 1,5 tahun pasien disarankan untuk datang untuk retouch. Okay, so saya ke pertanyaan selanjutnya. So, Dr. Larry, Perfectha is considered the new filler in Indonesia. So how do you compare with other Europe brand fillers that's already in Indonesian market?
So if you use the Perfectha range of filler, you generally tend to find that the extrusion force is much smoother compared to others. And also even when you're using a subskin, you find the extrusion force is actually quite easy. And you find that compared with other fillers that you have in the market, maybe it's because of the much less amount of BDDE that they use, you find that there's remarkably very little amount of swelling. We find it across the range for both fine line, subskin, and also for derm, and also for deep. So the best part is, because I'm not sure if you've ever done other fillers like following injection of chin, they tend to complain a lot of swelling. You need a lot of TLC after that, reassurance of the patient. For this Perfectha range, you'll find that there's much less degree of swelling, and also the moldability is actually as good as any others, really. So if you want a patient with minimal downtime, this is probably one of the fillers that give you the least amount of downtime, least amount of swelling, and one of the most precise results that you can give.
Okay, thank you very much. Tadi ada pertanyaan, Perfectha ini kan tergolong filler baru di pasar Indonesia. Ada pertanyaan, bagaimana jika dibandingkan dengan filler-filler, tentunya ya filler-filler sejenis brand Eropa yang ada di Indonesia. Ya pastinya di Singapura juga ada. Tadi Dr. Larry menyampaikan bahwa Perfectha dari pengalaman beliau tidak kalah dengan filler-filler yang ada di Eropa. Bahkan dia merasa hasil yang Perfectha berikan lebih sangat aktual dan akurat dengan pada saat pengerjaan, dan lebih tidak bengkak jika dibandingkan filler-filler lainnya, sehingga pasien tidak akan mengalami downtime yang lama gitu. Oke, saya akan lanjut. Oke, so Dr. Larry, dari Dr. Apri ya. Do you have any bad experience to share with us about making social media jawline in male or in female patient? Is there any challenges, and how do you manage it?
I have to admit, the jawline is when patients come in during the assessment, if patients have excessive amount of fat, okay, that's probably the last thing that they need. They actually need to lose weight before they start having a beautiful jawline. So So one of the challenges is always dealing with excessive amount of fat. So in my clinic, sometimes we do get them to go through 2 cycles of injection lipolysis to reduce the amount of fat, and then followed by wearing the sling, and then for doing that treatment for them. And then in the beginning, I also if you follow the DIDO's classification strictly. So what I'm trying to say is those patients with class 3 are the most challenging ones, those with excessive amount of fat. So sometimes we have to use even 2 cycles of injection, and quite a lot. And also following injection, we find that they tend to have a lot of swelling. So you tend to be quite nervous when there's a lot of swelling. So sometimes you do give them some prednisolone to reduce the amount of swelling also. And then followed by wearing the brace 2 days later after that. And then it's only when all the swelling is down, then you can start considering using chin fillers to help them. Because otherwise, patients with excessive amount, no matter how much weight how much fillers that you put in, or how much thread lift that you use, they're just going to have a lot of excessive amount of fat down there. So yeah, so the most challenges that I have is many patients with mainly those type 3 ones with a lot of fat.
Oke, thank you very much. Tadi ada pertanyaan mengenai apa ya pengalaman yang kurang menyenangkan. Maksudnya pertanyaan kurang yang pokoknya pengalaman Dokter Larry yang kurang menyenangkan pada saat men-treat area jawline. Tadi beliau menjawab biasanya yang kurang menyenangkan itu pada saat ketemu pasien dengan fat yang sangat banyak, terutama pasien-pasien yang tadinya gemuk, terus tiba-tiba jadi kurus, area sininya fatnya masih tersisa banyak dan kendur. Terus beliau biasanya melakukan lipolisis tentunya terlebih dahulu untuk mengatasi hal tersebut. Lalu yang juga memberikan tantangan adalah pada pasien yang bengkak. Jadi misalnya setelah dibenang, ternyata pasiennya bengkaknya agak berlebihan, sehingga biasanya harus ditunda dulu kurang lebih 2-3 minggu untuk dilanjutkan dengan treatment filler. Oke, Dok, ini waktu kita sudah hampir habis. Mungkin saya akan bacakan 2 pertanyaan terakhir. So, Dr. Larry will almost finish. So, I'm going to read 2 more questions before we end our Q&A session. Okay, so Dr. Larry, how deep to administer Perfectha in the jawline area? Is it the subcutaneous or in the periosteum? Are you going to use the same approach from between young patients or old patient who already has a sagginess because of the risk of the migration?
So, when you do your plane of injections, mainly deep subcutaneous, unless you are injecting on the bone on the gonio angle to recreate that. Otherwise, all your planes are all deep subcutaneous, which is why I like doing the jawline, because your plane of injection is all above the platysma, which is very, very straightforward. And then for the elderly and the young patients, I prefer I like to do the young patients because they have a very good bone stock. So when you have good bone stock, you just have them redefine the jawline. So if you look at the young lady, the 36-year-old that I did, just by putting in 6 mils of filler, you can have really nice result. Whereas if you look at the Caucasian men who tend to be a bit more elderly, yes, you can help them regain the jawline, the bone stock, the well-defined jawline. However, you also have to address the skin laxity of the platysma and the neck also. So in summary, so the plane of injection is mainly deep subcutaneous. You're nowhere in the periosteum except the gonio angle, because your facial artery is coming off the external carotid and it causes over the angle of the jaw, the antegonial notch. So you want to be above that plane. So the safest plane is subcutaneous layer. So nowhere near the periosteum except the gonio angle. And also, also the younger patients are generally easier to treat as compared to the older patients because they tend to have less bone stock, higher skin laxity also. Thank you.
Yeah. So I want to emphasize something. So for the old patient who has already displacement of the jowl fat,
Mhm.
is it safe to do it in the subcutaneous, or the filler is going to go migration with the displacement of fat?
So for the elderly patients, if you put in a thread inside, it will help you nicely fold. It'll help you fold the fat nicely over the bottom of the jawline, and then you can start putting in your fillers itself. So there's much less risk of migration.
Okay,
Hmm.
thank you.
But if you do not put in
Okay.
the thread itself, there's a very high risk of migration, or you get very vague, not very sharp jawline.
Oke. Oke, tadi ada pertanyaan, Dok, bahwa seberapa dalamkah kita melakukan treatment filler di area jawline, apakah di atas tulang atau di daerah subcutaneous? Terus Dr. Larry menjawab, yang dilakukan penyuntikan di atas tulang itu biasanya hanya di area mandible angle. Nah, sedangkan untuk area jawline cukup dilakukan di area subcutaneous yang deep, jadi deep subcutaneous. Nah, mengapa? Karena itu adalah area yang teraman, Dok, karena biasanya arteri facialis datangnya dari bawah, jadi dan di atas tulang, sehingga untuk area sini disarankan di subcutaneous deep. Nah, terus ada pertanyaan pada pasien-pasien yang sudah sagging, terutama area pre-jawnya, apakah akan menimbulkan migrasi dari filler tersebut? Tadi dijawab bahwa bahwa disarankan kalau pasien-pasien yang sudah ada displacement atau ada disposisi dari lemaknya, disarankan untuk dibenang terlebih dahulu agar pada saat di fillernya lebih memberikan garis jawline yang lebih jelas. Oke, saya lanjutkan. Mungkin ini adalah pertanyaan terakhir. So, Dr. Larry, this is the last questions. So, how many? Sorry. Okay. How much cc? It's a maximum dose for a filler jawline. Is there any maximum dose?
Sometimes if you use there's not really a maximum, because if you look at it really depending on the size of your patient. So if a patient is a big Caucasian man versus a small Asian lady, so it's very hard. But on average, a nice jawline needs average about 6 mils. But of course, it also depends on some patients with some degree of chin protrusion. You find they need to put a lot more there. So a lot depends on where's the area of deficiency and also the original size of the patient. So even 6, even to 8 mils, it shouldn't be a surprise. If patients got some degree of chin protrusion, you need to emphasize at least 2 or 3 mils to that area. You're seeing patients with very protruded chin. And so for a big Caucasian man, you probably need quite a lot of filler also. So you might find that you need a higher degree for such people. So in summary, it's not really the number of filler, but it's the doctor's sense of aesthetics and also how much the patient can afford.
Okay. Okay, thank you very much. Ini ada pertanyaan terakhir, berapa maksimum dosis filler yang bisa disuntikan ke area jawline? Tadi Dr. Larry menjawab kalau dirata-ratakan kurang lebih 6 cc biasanya, tentu saja itu tergantung dari kebutuhan pasien. Seperti pasien Asia wanita tentu saja akan berbeda dengan pasien pria ras Caucasian ya, atau pasien ya dari barat. Nah, biasanya kalau pria dan misalnya ras Caucasian biasanya butuh lebih banyak filler tentunya dibandingkan dengan pasien Asia. Jadi kembali lagi ke konsep estetik atau penilaian estetik dari dokter itu sendiri, dan apakah pasien bisa afford untuk dilakukan treatment di waktu yang sama dengan sebanyak filler. Tapi biasanya untuk area jawline dan dagu kurang lebih di 6 cc. Oke, yang tadi adalah pertanyaan terakhir yang dijawab secara langsung oleh Dr. Larry pada malam hari ini. Kalau rekan-rekan sejawat sekalian masih punya pertanyaan, bisa lewat Instagram kami, Sinclair Indonesia, atau bisa lewat email kami, nanti pasti akan dibantu untuk dijawab. Oke, Dr. Larry, that's it. Our last question. So yeah, thank you very much for the interesting and wonderful presentation and Q&A session. Thank you very much. Oke, dan saya mengucapkan terima kasih banyak untuk dokter-dokter sekalian. Izinkan saya sebelum mengakhiri webinar ini menyampaikan beberapa informasi penting dari Sinclair Indonesia. Oke, ini adalah special offer dari Perfectha dengan promo beli 4 gratis 1. Perfectha ini adalah filler made in Europe dengan standar CE dan FDA approved, namun dengan harga yang jauh lebih affordable dibandingkan dengan filler dengan karakter yang sejenis. Yang kedua, ini ada hands-on workshop. Untuk detailsnya dokter bisa kunjungi Instagram kami @Sinclair Indonesia. Di situ ada nomor WhatsApp dan nomor WhatsApp dan informasi mengenai ketentuan-ketentuan workshop, atau dokter juga bisa menghubungi produk spesialis kami yang ada di area dokter-dokter sekalian. Oke, ini juga dok kita punya Sinclair Indonesia di channel YouTube. Ini ada siaran ulang dok untuk webinar-webinar kita yang terdahulu, termasuk nanti akan ada webinar ini juga ditayangkan. Jadi dokter bisa ikuti channel YouTube Sinclair Indonesia dan bisa juga mempelajari kembali webinar-webinar yang diadakan sebelumnya. Terima kasih banyak dokter-dokter. Untuk Sinclair College juga ada aplikasinya, dokter bisa unduh, ada di Apple, di App Store atau di Google Play. Dokter bisa unduh aplikasi Sinclair College. Di sana banyak sekali informasi-informasi mengenai produk Sinclair, begitu juga dengan rekaman-rekaman presentasi dan webinar yang menunjang praktek dokter tentunya sehari-hari. Oke, terima kasih banyak sudah mengikuti webinar di malam hari ini. Kami mohon maaf jika ada salah-salah kata, dan sampai jumpa di webinar Sinclair Indonesia selanjutnya. Selamat malam.